Welcome, everyone, and thank you for joining us from wherever you are, whatever part of the world you are joining us. We welcome you to this special virtual panel discussion on One Health. My name is Alison Kentish, and I'm a science journalist. I'm joining you from the island of St. Lucia today, but I also call the island of Dominica home. I cover disasters, climate change, and public health from the Caribbean, and I'm really happy to be part of today's discussion because more than anything else, it is solutions based. We all know that One Health connects the dots to make that important link between human, animal, and environmental health. And while it's not new, its integrated approach and value has really come to the fore in recent times, particularly with the COVID-19 pandemic, underscoring the importance of preventing, predicting, detecting, and of course, responding to global health threats. So today we'll discuss the importance of One Health to building resilience against emergencies and disasters. And this is, of course, a timely theme as October 13th is recognized annually as the International Day for Disaster Risk Reduction. Now, I want to introduce you to our featured speaker and presenter, Natalia Casas. She holds an MSc in epidemiology, management, and public health policies from the University of Lanús and a specialization in field epidemiology training program of the University of Tucumán. She's the National Zoonosis Coordinator in the Ministry of Argentina since 2010, working in the surveillance, prevention, control, and eradication of zoonotic diseases, including planning and management. She was the supervisor of the regional unit of epidemiology and environmental health in the Ministry of Health in the province of Rio Negro, working in zoonosis, epidemiology, bromatology, and environmental health. Now, previously, Dr. Casas worked in the Faculty of Veterinary Science at the University of Buenos Aires and in small animal clinics. She has authored and co-authored over 40 publications on topics such as rabies, hantavirus, poisonous animals, leptospirosis, yellow fever, and more. Dr. Casas is part of regional groups coordinated by organizations like the Pan American Health Organization, PAHO, and the World Health Organization. And to our panelists, we have Miss Ashley Lashley. She is a UNICEF youth advocate and Barbados's CARICOM youth ambassador. She runs the Ashley Lashley Foundation. This is an NGO which has been doing some really powerful work in the areas of social development, particularly in health, the environment, and human rights. One of the foundation's flagship initiatives, the Healthy and Environment Friendly Youth, known as the HEY campaign, is working towards a global movement to place children and youth at the center of the Sustainable Development Goals, the SDGs, and to bring change to child health in the context of climate change. We're grateful to have with us today also Dr. Laura Lee Bodrum. She's the current head of the Caribbean Field Epidemiology and Lab Training Program at the Caribbean Public Health Agency, CARPHA. That agency provides technical cooperation in public health capacity building and lab reference services to 26 Caribbean member states. Dr. Boudram holds a PhD in biochemistry from the University of the West Indies and an MSc in epidemiology from the London School of Hygiene and Tropical Medicine, University of London. Her primary work centers around multidisciplinary training initiatives for public health workforce development, including the effects of climate change on health, disaster risk management, and emergency response. She served previously as the molecular biologist at the Caribbean Epidemiology Center and was the former head of vector-borne diseases at CARPHA. She works with regional and international partners on strategies to reduce the morbidity and mortality associated with climate sensitive diseases, and that is using a One Health approach. And finally, we are awaiting Mr. Glenroy Toussaint. He should be joining us shortly, and he is the local government commissioner in Dominica. And Mr. Toussaint is a social protection specialist with over 30 years of experience in the area of community based disaster risk reduction. He's the principal advisor to the government of Dominica on matters relating to local government development and administration. Since 2017, he has been spearheading efforts towards building community resilience. And he is doing so through a series of capacity building trainings for vulnerable communities. The capacity building initiative is referred to as community emergency readiness initiatives, which seek to build the capacity of vulnerable communities to be able to operate independently for at least 15 days following a disaster. To date, that initiative has strengthened community based institutions and the capacity of 40 vulnerable communities in Dominica. So I now hand you over to Natalia, and Natalia, the virtual floor is yours.
So Natalia, you have your microphone muted.
I'm sorry. I talk and you don't listen. Well, I'm going to talk about One Health. So first of all, I thanks for the invitation and the opportunity to talk about One Health. Well, I'm from Argentina, and my language is Spanish, so I apologize for my pronunciation. And if I'm wrong with some words, I apologize. Well, next, please. Well, the first part, I'm going to talk about the panel of One Health high-level panel that I'm the part of this panel. Next. Next, please. Thank you. Well, you know that there's a lot of causes, of reason why the increase of interaction between human, animal, environment. There's these causes also increase the occurrence of zoonotic disease, like the last pandemic, SARS-CoV-2, or Ebola, Zika, avian flu. There's a lot of diseases that can be transmitted to animals to human and can be epidemic or pandemic. So we have to work in the prevention. These causes, these reasons may be ecosystem damage, climate change, migration, urbanization and globalization. You know that you can be in the country to the country in hours. I'm in Argentina, and in less 40 hours, I can be in China. And also, not only people move, also animals move with the people. Another cause is intensive agriculture or intensive animal production and contamination and pollution. Next, please. Well, so in 2021, the International Organization, World Health Organization, the World Organization for Animal Health, ex-OIE, the Food and Agriculture Organization, and Environment Program call for experts to work in this approach of One Health. So in May in 2021, we have the first meeting, and we are working until since that year 2021 until now 2023. Please, the next. So we are 26 multidisciplinary professional, veterinarian, biologists, anthropologists, doctor from different countries, from America, Europe, Asia, Oceania. There are a lot of people, professional in different countries with different disciplines. And the first term of this panel is, I told you that is 2021 until 2023, and now there's a second call for a second term of this panel that we are work with the implementation of the One Health, and also work with the One Health plan of action. Next, please. The other, thank you. So in these 2 years, in 2021 until 2023, this group we make some publication about One Health. All these publications they are in the website of the organization's international organization. So this publication we make for the professional and the people who work in the countries to help to work with the One Health approach, and to help to work with implementation of this approach. Please, next. So what is One Health? Next, please. There's still a paradigm in use that we had to change. The people or professionals think only in human disease. So in disease surveillance, in research, and in treatment. But we had to change this paradigm to One Health. You know, that we had to think in environmental surveillance, prediction, and prevention. Prevention diseases, prevention emergencies. This is very important to work with human disease, animal, and environment. Not only think in human disease. Next, please. So the new definition of One Health is more complete. You know, the One Health is integrated approach that works with health and human health, animal health, and environmental health, and recognize that these sectors are closely linked and interdependent. And important that this approach mobilize multiple sectors, disciplines, and the more important, communities. The community is part of this approach, the important part of this approach of One Health. And this definition talks about healthy food, healthy water, energy, air, and important that talks also about the climate change. Next, please. This is the diagram of the definition with the sectors and the disciplines, environment, human, animal, the society is very important, the rural areas, urban areas, and with the objective to have healthy ecosystem, healthy animals, and healthy humans. And we work with the 4C, with all sectors. We work with coordination, collaboration, communication, and capacity building with the 3 sectors. Next, please. So this is theory. No, this is a definition theory. So we have to move to the implementation in the practice, in our work, in our daily work. So how to work with this approach in our work? Not only if you work in the Ministry of Health or in the Ministry of Agriculture, in all sectors, we have to work with this approach. Next, please. So the first point is to join cross-sectoral coordination mechanisms. In our work, we have to recognize the people and the sector. We have to work according to this approach of One Health. This is important to have daily to daily communication. And one of the points very important is to cross-sector data sharing. Now we have to know what is the other sector is working and information they have. So all the sectors have to know what is other sector working. This is and have the information. And another point is to join simulation exercise. For example, in Argentina, last year, we made simulation exercise of avian flu. And this year, like a lot of countries in America, we have epidemic of avian flu. So it was important to be prepared of this disease or other events. Another point is measuring risks together with all sectors and to have active cooperation in control programs. Where I work especially in zoonotic control program, but the next, please. But the idea that the people, the human is not alone in the world, no? It's connected with animal and environment. And this approach of One Health not only include zoonotic disease, that's what it's my expertise, but include too antimicrobial resistant, foodborne diseases, environmental health, of course, and others events. Maybe you work in this event, and you know, yes, I have to work with approach. If you work only, we can't control or eliminate any diseases. Please, next. So I'm going to talk about two diseases that are very important in the world, in my country too, but in the world too. In relation to rabies, it is a viral disease. Is mortal in the world. We have 5,000 deaths of people in all the world. And it's a great example to how to work in One Health approach. So we work in animal health with the vaccination of animals, principally dogs and cats. That cat is my cat, Simon. It's called Simon. It's very important to have the vaccination of animals. In many countries, the vaccination of dogs and cats are obligatory, and the campaigns are free. We work too in human health with the prevention of this disease in human. The people can be vaccination, can have the vaccination too. So the prevention is with the vaccination. And we work also with prevention of if the people is bitten by an animal. And we work in the environmental health and biodiversity also, because this disease can affect wild animal too. So we work with One Health approach with animal health, environmental health, and human health. The next, please. Well, this is another disease. It's a parasitic disease. is hydatidosis or echinococcosis, and also is a great example for One Health approach. In this disease, the dogs transmit the parasite to people, so we can work in animal health. We can deworm animals, and in human health, we work in the prevention too. We work in diagnosis and treatment for the people. And also, we have the sector of environmental health and biodiversity, because this disease, echinococcosis, attacks to wild, sorry, wild animals. And also, the environment can be contaminated with the parasite, because it is transmitted with fecal material of dogs. So these two diseases, two examples of implementation of One Health is very important, because if we work only with humans, for example, we can control this disease, or we can control any event, and we have to work with animals too, and with the environment also. Well, I think this is the last, the next. Well, thank you very much for listening to me. I hope you can understand me. Well, I'm here for the questions.
Thank you very much, Natalia, for that. And before we bring our panelists back on, I just want to let our audience know that this really important discussion would not be possible without the support of a special project called the Building Community Resilience Through Emergency Communications and Preparedness, Barbados and Dominica. These countries know all too well about the devastating impacts of a changing climate. We are living through it, but we also live in a multi hazard zone. So we know about hurricanes, we know about flash flooding, we know about extreme weather, and of course, the toll of health shocks like the COVID-19 pandemic on our countries. So, this is a 12-month project, and it's funded by the Clara Lionel Foundation. It started in May 2023, and it's bringing critical information solutions to communities who need it most. And in the process, it's building resilience to future climatic, health, and environmental emergencies. So, thank you to the project and to the sponsor, the Clara Lionel Foundation, for making events like this one, this important roundtable today, possible. And we just want to bring our panelists back on, and we want to just ask them how One Health is related to what they do, and whether they have any current or future activities related to One Health within their department or organization. So we can start with Miss Lashley.
Thank you. Hello, everyone. As you guys know, my name is Ashley Lashley, and I'm a youth activist from Barbados, a youth climate activist, rather. And I've had the privilege of dedicating the past 4 years of my life to youth advocacy with a strong emphasis on social development issues encompassing health, the environment, and women's rights. And through the Ashley Foundation, we've been actively engaging, raising the awareness, and taking action on various global challenges, but predominantly from a youth led and youth engagement perspective. And in the context of today's One Health panel, I'd like to highlight our work, especially through the Healthy and Environmentally Friendly Youth campaign, which we call HEY, where it looks at the link to the concept of One Health. And our campaign, initiated in the Caribbean but now has a global outreach that focuses on the intersection of climate change and health, and is actively seeking to build bridges amongst youth, both in the Caribbean and around the world. And I remembered when I first started this movement, we had a network of over 21 Hey ambassadors, in which we call our youth activists. And to date, we have a network of over 200 young persons advocating for climate and health justice. And through that program, we continue to build the capacity of young persons on different topics relating to climate change and health. But we also assist with the grant funding component as well to support the projects in which young persons globally are undertaking. And even throughout the foundation as well, we recently launched last year another program called Eco Active Youth, which looks at getting our kids involved in what it means to protect the environment, what it means to live a healthy lifestyle, and then we also get them active in some form of physical activity. So through everything in which we have done since 2029, I would say 2019, we recognize that climate change has a profound implications for both the environment and for human health, particularly in regions like small island developing states where vulnerabilities are heightened, especially coming from one myself, Barbados. So our efforts under the Ashley Lashley Foundation really aims to address these intertwined issues by involving young people in the conversation and action towards a healthier planet and healthier communities. Thank you.
Ambassadors to over 200. So I think, I mean, those numbers speak clearly to the work that you do, and the future is also bright because you're getting really young people involved and getting involved in climate action, climate justice at that age. I mean, it's really, really wonderful work. So thank you for that. And I now will give the floor to Dr. Boudram to just tell us a little bit. She's involved in something so intrinsically linked towards one health. It's the nexus between climate and health, and exactly what we're discussing here today. So let's hear from her.
Hi, good morning, and thank you. So just to give a little bit of background, the Caribbean Public Health Agency is a CARICOM-based agency, and we recently, actually, we're now 10th year of operation, so we celebrated our anniversary this year. With respect to COFA's mandate, we have a very broad public health mandate. And it was good to see when Dr. Casas presented the different areas that are intrinsically linked to One Health. So she mentioned issues such as foodborne disease surveillance, agriculture, vector-borne disease surveillance. She also mentioned chronic communicable diseases, mental health and injuries, climate change and health. And in fact, COFA actually works within all of these different areas. So we carry out disease surveillance, and we also operate in terms of emergency and disaster response. Now, much of our work, especially at the present time, centers around integrating One Health into all aspects of what we do. So, for example, just to give you a little bit of background, I think we're all very familiar with how the COVID-19 pandemic started, but the underlying premise is that it was a crossover event, a zoonotic event between animal and humans, and then of course it spread very widely. And one of the things that we always have to be mindful of, especially in today's climate where global travel is so easy, a disease can arise, an infectious disease can arise in one area of the world, and within 24 to 48 hours, it can present in another part of the world, for example, on our Caribbean shores. So in order to, there were various mechanisms to control the COVID-19 pandemic, and it didn't just involve a human health response. Many other sectors were involved, including national security, legal affairs, etc. So it speaks very much the One Health approach. And I just wanted to highlight that it's not just human and animal health. There are many other operating systems and sectors in the background that help promote and support the work that we do in terms of protecting health broadly. Now, in terms of some of the more recent work that we do, climate change and health is a very large area of focus for the agency, and it's a very pressing issue for our Caribbean small island developing states. As we well know, we're located in the North Atlantic hurricane belt, so we are very much prone to hurricanes, and we've seen an increase in the severity and frequency of hurricanes over the past 10 years or so. So disaster resilience is very much within our portfolio and managing health within that sector. Now, there are also specific interventions that we are involved in as part of some of the adaptation and mitigation measures in terms of strengthening the resilience of Caribbean SIDS. And some of the more recent work involves the building of early warning systems for health, particularly for climate sensitive diseases. So at the moment, we're working with some of the different countries within the Caribbean, and we're looking at integrating epidemiological and human health data together with climate data as well as environmental data. And what we're doing is building risk prediction models that can help assist us in predicting more or less when an outbreak potentially can occur. For example, a vector-borne disease outbreak such as dengue. With that information in hand, our ministries of health can plan appropriately with a good lead time to put in place measures that can either prevent the outbreak or mitigate the effects of potential outbreaks. Another area that we're working with in terms of building climate resilience within the Caribbean is development of national food and water safety plans for some of our different countries. Now, this involves a very integrated multi-sectoral approach. So it's something that we've started within the last couple of years, working in partnership with agencies such as PAHO. But one of the things is that we've been involving not only health, but agriculture. We've been working with Ministry of the Environment, Social and Economic Affairs, even as far down as gender affairs and child affairs have been involved in the work that we do, because we recognize that all of these different areas are very important, and the national coordination is very important to build plans that can help build resilience within the Caribbean to ensure that we have safe and secure food and water supplies. That's it. Thanks.
Us know about some of the work that is ongoing and will continue, especially the risk prediction models and the national food and water safety plans. I think those are really, really interesting and will be really good for our countries. And I just want to bring on Mr. Glenroy Toussaint. He's from my birth country, Dominica, and I know Dominica, we're in the hurricane belt and somehow we're constantly locked in this cycle where we get hit, we're rebuilding. 2015 was a really bad year for us. 2017 with Hurricane Maria, 226% of our GDP just gone. And so I just want to hear a little bit from him about some of the work that he does and how it ties into this One Health approach for a country like Dominica that is so vulnerable to multi-hazards.
Okay, thank you very much. And let me say it's a privilege to be here with you. And morning to everyone. It's always a pleasure. Of course, thanks, moderator, for your wonderful introduction. Certainly, Dominica has been one of those islands severely impacted by climatic and weather events. Of course, I can talk of the most recent events being Tropical Storm Eureka in 2015 that impacted well over 90% of the GDP. And in 2017, we were hit by the massive Hurricane Maria, which in fact wiped out 226% of our GDP. Of course, stemming out from that, the Prime Minister articulated a vision of Dominica becoming the first climate resilient country in the world. But of course, to bring this vision into reality, there had to be some strategic objective and strategic positions as it relates to building this national resilience or that we are talking about. And certainly with the formation of the CREED, Climate Resilient Executive Agency, that was established in 2018, Dominica had to first develop what we call a strategy. So in 2019, there was a national resilience strategy developed, which would look at, which serves basically as the blueprint for initiating this national resilience thrust. Of course, that was basically aligned to strategies, and things relating to what is necessary to bring Dominica to this platform of resilience. But it required additionally moving from just strategy into action and action plan. And so late in 2019, again, a very critical document was developed, and that was called the Climate Resilient Recovery Plan. In fact, 2020, that was developed rather. It's called the Climate Resilient Recovery Plan 2020-30. This, in essence, articulated the vision and the plans and the program of what would require, inclusive of financial resources, to execute this national thrust at building resilience and becoming one of the first climate resilient island or nation in the world. The document itself, the CRRP as we call it, highlights three very critical areas. One is what we call a robust economy, an economy basically that would withstand to shocks, and I refer to shocks as adverse weather events, climatic events, and of course, other health issues such as COVID-19 pandemic that really touched the entire world. So that's one. So that's robust economy. There is the one called durable infrastructure. Of course, importantly, we're talking of the housing stock. We're talking about infrastructure in terms of bridges and roads and things of that nature that would build it in such a way that it would withstand or be some sort of resilience against particularly climatic and weather events. And the third most important one I consider is what we call strong communities. And strong communities really refer to the ability and capacity of the communities to respond and mitigate to the impact of weather events and climatic events as well. Of course, one of the critical areas within the strong communities is one of the initiatives that earlier the moderator mentioned when basically introducing me to the audience, is that of the readiness of the communities. And that initiative, as was explained earlier, is called the Community Emergency Readiness Initiative. And that initiative really is meant to build the capacity of the communities to respond, to effectively and efficiently respond to weather and climatic events. And one of the most important aspects of that is for the communities, importantly, to be independent of any support within 15 days, or for at least 15 days of any major shock. So if we are to be impacted by a hurricane or some health issue, that the community will be in a state of readiness to at least be independent of any support for at least 15 days that require human resources, that require other aspects as it relates to infrastructure, enhancement of the communities. It also refers to the issue of the resources, and we're talking of food and otherwise alternative sources of energy, whether it's power, water supply, and all of those things. So that's a comprehensive package in terms of the building the resilience. And one of the capacity building components is critical because we are building the capacity, but importantly, we have to strengthen institutions at the community level. We have in Dominica what we call community-based disaster management committees, and they are established in communities. These are structures that are meant to assist or to coordinate disaster-related activities in the communities. And we have to ensure that, importantly, too, the individuals within the community
Hi, Glenroy. I'm sorry you broke.
they too can respond in that regard. So that is very that is very critical. So that is what we're looking at. So what we've done is we did a vulnerability assessment of the communities island wide. And so what we did, we ranked the communities based on their vulnerabilities. And so we had 4 rankings. One was the most vulnerable communities. Out of that, we got about 13 communities that are the most vulnerable. And the vulnerability have to do with the frequency of the impact as it relates to hazards. For example, those communities that were identified really were from the east, the south, and the north. And that stems from the frequent impact. For example, if you have 6 inches of rain, these communities are exposed to flooding and land slippage and things of that nature. So that's 13, most vulnerable. And then we come to the more vulnerable communities. There were 26 of those more vulnerable communities. Then we come to the vulnerable communities, that's about 14. And then we have the least vulnerable, that's roughly about 16 communities. So we were able to rank those communities. And so we felt that it was necessary to work firstly with the most vulnerable. And so we looked at how do we strengthen the gyms of providing capacity, allowing them to understand the dynamics of system I'm using my phone and I get interrupted. So I'm sorry about that. But importantly, so we had to begin with the most vulnerable, and we were very happy that we got some funding from the UNDP to execute what we call a capacity building project for vulnerable communities. So we looked at how do we strengthen the structures, that is the disaster management committees, the local authorities. We have a network of local authorities or local government, and for good measure, I happen to be the local government commissioner, so that comes under my jurisdiction. And so we had to strengthen in terms of providing capacity, allowing them to understand the dynamics of systems and weather systems and other shocks that may impact us, and that often impact those communities, the vulnerable communities. The whole question of first aid and CPR, the issue of communicating during disasters. I mean, that was one of the major gaps. I mean, many of the communities were cut off after Maria, and there was absolutely no communication with how we could strengthen those communities in terms of improving and enhancing the communication of those communities. And we look at the whole assessment. How do you conduct assessment, damage assessments and need analysis as far as those climatic and weather events are concerned? And very importantly, and this is one of the areas, and that's where we tie in with the One Health for exercise here this morning. Very importantly is that while we focus in our recovery a lot on infrastructural development, improvement to the homes and improvement to infrastructure and enhancement of the economy, but one of the gaps that we identified is the whole psychosocial support. Psychosocial support for persons in disasters. And we realized clearly that there is that gap, or there had been that gap um, post Maria, where people um, continue with their anxiety. They are not given that sort of psychosocial support as it relates to the anxiety and what they go through and all of those things. Their mental health is critical. And so a lot of people overlook the mental health and the psychosocial, and people simply look at the infrastructural and the other things. Yes, they're very important, but also important. If you do not have a healthy people, then it is even um, more task, enormous task to ensure that we build that resilience. And so within that project, we looked at psychosocial support. So we did a training of trainers looking at some key persons within the public sector and providing them with the requisite training so that they too can impact and assist in that psychosocial support for for community persons, particularly the vulnerable communities. I must say, through this intervention, we've been able to complete this exercise with 40 vulnerable communities on island. And one of the things that it's always good to measure impact. And so, while we were not happy of the trough that happened in November, on the 6th of November 2022, where many of those most vulnerable communities that I mentioned in the east and the southeast were impacted. There were major slides, and there was one fatality through a landslide. And so while we did not, it also tests the resolve of the communities. And so what we were able to do is to in many respects assess the impact of the training that we had in those communities. And we really saw it, for example, that the communities in the east were cut off on the 6th of November 2022. And the communities were able to the residents because they were cut off. So there was no way that access could be made to those communities only by foot. And so the community members themselves came together, they enhanced their. The important thing is there was no electricity, but through our intervention, we were able to establish within the community facility what we call a solar system. So there was while you were not able to provide system to the community, but this main facility had electricity, and that's where all the people were pouring their phones and all of those things, and that's where the communication was taking place. There's an enhanced communication system in that facility, and it's under this sort of initiative that we were able to do that. And so we're able to measure the impact of the program, and of course how well it worked for the people in the east as it relates to the November 2022 drop. So I am pretty pleased that Liz we were able to measure it, and we are seeing the positive of this intervention where we enhance the capacity of communities to respond. As I said, we still see the need for us to strengthen our psychosocial support, and we are hoping that we can continue that process because we clearly recognize that that is necessary. I will tell you, for example, just
I'm
during
sorry.
Philip.
I have to stop you briefly because I know that Ashley needs to leave. So I just wanted to give her a chance to, if she had any final words, and before she leaves us, and just a chance to for her to wrap up, and then we will come back. So Ashley, we are really, really grateful that you can join us. We appreciate that you need to leave, but I couldn't let you leave without telling you and recognizing the wonderful, wonderful work that you do, particularly with children. So before you leave, any final words, maybe just your vision, you've gone already from 21 ambassadors to over 200. What's the goal? 2,000? Where are we going to next?
Well, the goal for the Hey campaign, moving ahead, even into 2024, 2025, is more going to be policy driven, where we want to implement different country networks on the ground, so that I'm hearing like persons talk about the necessary psychosocial support, even when it comes to young persons. Eco anxiety is on the rise. So we really want to work on having climate change and health implemented on the agendas of schools globally. So that would be our prime mandate going forward. But even as I continue to hear the discussion, and I know I have to leave, but I really have a question that I want to ask Natalia, and I hope that you can answer, Natalia, because I think it's also going to help me as the campaign and the different work in which we're doing on climate change and health and different health related topics. What advice or strategies do you believe can really help us effectively navigate the complexities of disaster risk management, especially within the context of climate change and health and its impact on human health? And then I also want to know, how do you think we can continue to empower young people to play a more significant role in mitigating these risks and fostering resilience in vulnerable communities?
Yes, so Natalia, you could take the questions. Yes. You're muted. Your mic is muted.
Sorry, I didn't. I'm sorry, I didn't listen to the question because I was in the phone call.
Okay, well, I could give you the second part first because she works so closely with youth. She wanted to know what more that you can do, or she can do, especially as a youth advocate, to empower young people to in this general area of One Health.
Well, this is well. First, I thanks Ashley and the others people, because there's very important experience on One Health in all the countries, and I think that One Health it's very important to work with law to protect environment and to protect health and people and animals. We have to work with the government because there's where we have to work with the government and important in One Health in this approach is to like I said, to work in the prevention. We work in the disease prevention because we can have another pandemic if we don't have we don't work in the prevention.
Thank you, Natalia.
Thank you very much, Ashley. And thanks for your presence here today. Thanks for all that you do. Thanks for making the Caribbean a better place by empowering our young people to, to just go forward and help protect our environment and our health. And we just want you to keep up the amazing work that you do. And thank you so much for joining us.
No, thank you. And I'm happy to be here. And I'll definitely continue to spread and build the capacity of young persons to advocate for the implementation of One Health concepts within their vulnerable communities and countries. So thank you, everyone. And my apologies for having to leave so soon.
We understand. Thank you so much. Bye.
Bye.
And I just want to say thank you to the audience because they've been very engaged. I think, Natalia, your presentation was really well received, and it has spurred a really important conversation. And so the questions are coming in. I'm going to try to take as many as possible because we really appreciate them. That's what we're here for, to just get the conversation going, this really important conversation. So I'll just start with the very first one for you, Natalia. I'm just reading off my phone. And well, we have questions for Glenn Roy. We have questions for Dr. Boodram. We have quite a few coming in. So one moment, and I will get to the very first one. And this one is for Natalia. Okay, so I'm sorry about that, but somebody in our audience wants to know how often are various stakeholders in government working with vets and what is their One Health role? So, what's the role of vets and how often that government works with them?
Sorry, I had to take the microphone. Thank you for the question. The veterinarians, the vets are a big part of One Health. You know what Health is multidisciplinary approach, but veterinarian, we work with diseases, zoonotic diseases, um, um, born diseases, vector-borne diseases too, foodborne diseases. So our work is very important in One Health approach. The veterinarians work in all sectors. I work in Ministry of Health, but we are a veterinarian working in Ministry of Agriculture or are working in Ministry of Environment. There are many veterans in government, for example, in Argentina. And in Argentina, too, this year, the Ministry of Health, there was a ministerial resolution about the importance of the work of the veterinarian in One Health. I think that it's very important that government have to work with veterinarian in this approach, and we have to work with many countries that to come work with veterinarian and in the government. This is very important, I think.
Natalia, we have one question for Dr. Boodram. and you spoke of national coordination on One Health. So, someone in the audience wants to know, they're thinking that the number of stakeholders must prove to be challenging because you must be talking about a lot of people coming together. So, how does SCARFA lead or contribute in national or regional coordination efforts on One Health?
Sure. So, for some of the different interventions that we're involved in, for example, the National Food and Water Safety Planning aspects, when we first approached this work, we would have consulted with, let's say, different ministries of health and, sorry, not different ministries of health, but different ministries within each country as well as pertinent agencies. So essentially, a scoping exercise would have been done in order to determine who are the key players and stakeholders that should be involved in this planning process moving forward. So I can safely say that for any one country, we have up to at least 20 different stakeholders and agencies involved in the process. And I do have to say, coordination can be a little bit challenging, managing all these different entities. But how we normally do approach it is that we speak with each ministry or agency and ask for representatives to sit on a national coordination committee. So much of the work that we do is very collaborative. The information and key insights that our stakeholders produce are instrumental in developing these plans going forward, especially in the face of a changing climate. You know, they of course know their country best and the different challenges and risks that they face. So once that is done and these plans that we're working with are developed, we actually hand them back over to the National Coordination or Oversight Committee for actual implementation, right? So that's at the national level. At the regional level, there are different mechanisms in place for liaising with the different member states of COFA, and there are actually about 26 different member states that we work with. So, for example, we have interactions with our chief medical officers through what we call a regional coordinating mechanism for health. Um, there's also at the ministerial level COSOD, which is the Council for Human and Social Development. So much of the work that we do filters up to their level for guidance and ratification. And then finally, of course, they're the CARICOM heads of government. So different mechanisms in different in place at different levels.
Okay, thank you. And I know that Natalia wants to add something to that. So, Natalia, the floor is yours. Your mic is muted.
Sorry, I have. No, I want to important to have information for the people. This is essential that the member of the population can have the access to the information. I have the example of Argentina, that information is public, all information of the diseases or any sector, the people can ask through the government website, and it's obligatory to answer this question. Not only everyone can ask how many cases of rabies are in Argentina, or everything we have to answer, and it's very important because the information of all this can be or must be public, and the people have to know.
Okay, thanks for that, Natalia. And it feeds in well to our next question because I think a lot of people in the audience were also really happy to hear from Mr. Tuse about the community aspect of it, some of the feedback we're getting about building strong communities, because you build strong countries by building strong communities, of course. And oh, Mr. Tuse, your location has changed. I
Yes.
realized you did everything you could to join us this morning. So it was
Yeah.
interesting to see you
Yeah.
from a vehicle. I was hoping you were parked somewhere nice, like the botanical gardens, a nice green space.
I'm back in my office now, so I drove and I'm back in my office.
Okay, okay, wonderful. Yes, so one of the questions is for you, and the audience member is saying that they recognize the importance of building strong communities, and they also recognize that it feeds to what Natalia was just saying about information, and they want to know if you work with other regional governments, regional agencies in terms of access to information?
Well, the thing is, we've been working with a number of international partners. For example, we have developed a strong alliance with the International Organization for Migration, and that specifically that sort of alliance has a lot to do with enhancing our community-based infrastructure, particularly as it relates to our hurricane shelters. We have been working with them. In fact, through this alliance, we were able to develop what we refer to as a modernized emergency shelter management manual. And that manual certainly has significantly helped in terms of our decision making as it relates to enhancing our shelter experience for persons who may require to be taken to emergency shelters during adverse weather and other events. We've also had a strong alliance with the Israel Aid, where we have, of course, our DRR for particularly our vulnerable communities. In fact, just a few weeks ago, the Israel Aid completed a project in the south with 3 of our most vulnerable communities on island, looking at providing, again, enhanced capacity of community residents in terms of disaster risk reduction, and of course, the provisioning of very important supplies, such as generators and first aid kits and things of that nature, we see as critical for the continued strengthening of our communities. I said, of course, earlier, we have worked with UNDP in the execution of several of those projects that I mentioned, and so we continue that sort of alliance with our international partners. Of course, we also work with SEDEMA. Of course, SEDEMA is the regional agency responsible for disaster management here at the regional level, and so we have been working with SEDEMA in terms of strengthening our communication in rural communities in particular, because as I mentioned earlier, we had a serious challenge in terms of communicating with those communities that were cut off during Maria. And in fact, even just during Philippe, there was a section of a community in one of our most vulnerable communities was cut off. It's only during the weekend that access the road was accessible to vehicular traffic and otherwise. So we have continued that sort of alliance. We clearly recognize the importance of communicating. One of the things that we're able to share as well, I have had the opportunity to, at several forums, share with the international community as to our experiences in terms of building strong communities in Dominica. I remember just last year I attended a local government forum for that was really organized by the Commonwealth Local Government Forum, specifically looking at resilience and building stronger communities and building resilience as it relates to climate change and climate change adaptation and things of that nature. So we have clearly recognize that. We continue to build those alliances and partnerships because we believe, and we have the utmost belief, that to attain national resilience, there must be community-based resilience. And that is why we believe in strengthening those communities so that they too can be able to respond. And if we are able to strengthen each and every community in Dominica, then ultimately we would have reached closer to that vision of becoming a climate resilient nation. So certainly we have been partnering, and we certainly are always open to share our best practices and the things that we do. And of course, to solicit, so to speak, ideas and suggestions from our partners, both in the region and internationally, so that we can continue to build on what we've started, and to ensure that we attain this ultimate goal of becoming a climate resilient nation.
Thank you so much for that. I consider myself a backpack journalist, so I move a lot all over. And not too long ago, I was in Dominica. I put on my boots and I went around and I saw some of that community building resilience in action as well, particularly as it pertains to early warning systems near rivers, and I know a lot of work is taking place. So thanks for letting us know. Access to information is such a big issue, and so thank you so much for that. Now we have a question from an audience member, Jaya, and she wants to know, with the growing diversity of experts in One Health, how has the vision of One Health, or how is the vision of One Health adapting to, to the changing realities in terms of, so it's a very important issue, diversity. Dr. Budram and Natalia?
Yes, I told that now is a new call for experts to be part of this group of experts of One Health, and they are they need another professional like lawyers, economics. That's very important to to can how to the plan, no, the One Health plan of action can be implemented. We need another professional, not only veterinarians, biologists that work with diseases. We need really, or the international organization need lawyers, economics. So in this new call, this is can lawyers and economics is open to this professional, because it's very important to work with them, and also professional like that work with the people, with the people behavior. This is very important to take part of this panel of One Health.
Thank you, Dr. Budram. From your experience in terms of just diversity, we know One Health now has to take into account so many different areas and bring them together. So in terms of diversity, how do you think that is working out?
So I will have to say the vision for One Health has changed over the years. I've been working in public health for quite a long while. And I would say in the initial days, really and truly, when we used to speak about One Health, it was the intersection between human health and veterinary health and agriculture and, a little bit of the environment. The vision is shifting much more broadly to encompass human, animal, and ecosystem health, which is much broader. So I'm in full agreement with what Dr. Casas indicated. So apart from some of the stakeholders I mentioned, she also spoke to, legal affairs, socioeconomic planning, etc. Now, since CAFA has a health perspective, there are some additional considerations for us with respect to the One Health approach. And I think Mr. Toussaint also mentioned this in his conversation as well. And that speaks to the migrant population, right? And we need to be able to cater for their needs, and also, some of the health issues that and the risks that our countries face as they move through, let's say, the Caribbean. So that's something that's very much there and to be considered. There's also the issue of vulnerable populations. And when we speak about vulnerable populations, we're talking about the elderly, the very young, and also, of course, not forgetting our gender issues, which have to be factored and considered when we're looking at these different approaches. So it's now really becoming this holistic, encompassing view. And it's a very interesting field to be working in right now. And it's very interesting to see how the different key partners and stakeholders come together and what they contribute as we build for the future.
Okay, thank you so much for that. I know a lot of journalists are also signed on, and the Internews with the Health Journalism Network is looking forward to publishing much more on One Health. to educating the public. And as a journalist myself, I know I'm listening. Yes, I'm the moderator. I'm pulling myself back at times, and I'm scribbling some notes as a writer as well, because I'm finding that there's so much really relevant, crucial information that from every single panelist that could give us, a really rich story. So I wanted to know maybe briefly from each of you, because I know you also consume news, you read, and as we as journalists go out and we write more about One Health, maybe first what you believe is lacking, or some areas that don't receive as much attention, and so we could build some richer stories, and how we can just write some stronger stories on One Health, on that connection between all the different facets of health. We could start with Natalia, and then we go to Dr. Boodram, and then Glenroy.
Um, yes, this is very important that the journalists work with One Health. I think that it is very important if you can write about local experience, because the local experience is essential, to local levels is essential, that because the local who works directly with people and animals and environment. So I think that it can be important to write about local experience, and it can be useful.
Thank you very much, Dr. Boodram.
Sure. So not necessarily an overlooked area with respect to One Health, but an area that we do need to concentrate on looking towards the future. And this one is a little bit near and dear to my heart. And this is actually strengthening of our workforce, including our public health workforce. So in moving to the One Health approach, as we've already identified so many key stakeholders and players on the field. And it's very important that all of these different players come together and they have a certain level of course, baseline knowledge with respect to what is needed for One Health. And then when we look into the actual subject matter experts, whether it's our human health practitioners or animal health or environmental health practitioners, we need to make sure that their knowledge, their training is elevated on a certain field. We need to ensure that they are looking across a broad sector when they're doing their work. And just basically applying what we've learned within the context of climate change. I do really need to stress this because climate change is here, it's not going away, and we have many, many things to face. So climate change impacts our health, whether it's human, animal, etc. So just some things to consider.
Okay. And Glenroy, is there any area you believe maybe deserves could do with some more media attention? We could look into, of course, your area is so crucial because it takes a look at community. It's my favorite thing to go into communities and report from the ground. So is there an area you believe that, could do with some more in-depth reporting, or,
Yeah, most definitely. As I said earlier, it is, in my view, I think it is overlooked, but it's very critical. It's a psychosocial support that we're talking about, and one's mental health. I will tell you, for example, there are many people, if we get rain of up to 3-4 inches, there's a lot of anxiety in Dominica. I mean, just the Philippe, we had about what, between 3 to 4 inches of, between 3 to 4 inches of rain, and some communities were flooded, and there was heightened anxiety. So I think we need to, in many respects, I think we need to, I think it's overlooked, but it's very critical, and I think we need to place a little more emphasis, and would very much like that attention to be given, in that area, because we believe it's important. I mean, there are other critical areas as well, as I mentioned before, but I think that one is very, very important. I also, I'm of the view that one's mental health is critical. So you can build and you can strengthen your infrastructure and everything of that nature, but if you don't have a healthy people, you are going to have a further challenge in building that resilience. So I think we need to put some emphasis here. People may not see it as in some respects something they see as tangible, but I think it's very important, and that is one of the gaps that we have identified. I mean, just a few weeks ago, I gave someone a ride, and they were just relating their story, the Maria story, to me. I stayed there listening, and said, "Okay, I understand," and that sort of thing, because I went through it. But the person had a different experience than I had, you know, and so it's those sort of things that you talk to the person. You talk to the individual, allow them to relate their story. I think we need to do a lot more documentaries, in particular in Dominica, of those experiences and those best practices that we have as it relates to building resilience at the community level. And I think that need to be further highlighted, and we can probably do well with some documentaries, on those sort of approaches, what have worked well. And certainly, there's a word that they call bounce back. But I don't use the word bounce back. My word is bounce forward. I don't like bounce back, because bounce back is simply that you have made 2 step backwards. You're just simply making 2 step forward. But that's not bouncing back. You need to bounce forward further than where you were. And that is the thinking. That's my thinking, and that's the thinking we have with this approach to building community resilience. Is bouncing forward, not necessarily back, but forward. And we are hoping that the intervention that we're making in Dominica, because the thing is, when you initiate programs and those sort of things, the intention is to ensure that there is some level of form of sustainability. So our intervention is to see it will work in the next 50 years. Of course, during that period, you may have to make some adjustments and reflection and all of those things. But certainly, what we're trying to create, though, importantly, is a culture of resilience. It's going to take some time. But what is important is for us in the region, I'm talking about the region, right? Not necessarily Dominica alone, but in the region, CARICOM and otherwise, is to create that culture of resilience. In other words, we build that sort of culture so that people understand that, listen, with climate change and everything, certain things are beyond us. Of course, it's argued that, human nature contributes to this climate change and increase in temperatures and stuff like that. But what if we build that culture of resilience? It means, therefore, it makes life much easier. So you don't, for example, have to constantly be informing your residents that those who are living in low-lying areas, they've got to move. The culture is so built. In Dominica, and of course, Ms. Kentish, you would know, in Dominica, we had this Kudme in the 1960s and 70s. The Kudme basically is people helping each other. And there was a culture of this cleanliness in our communities, so that people did not have to tell people that they have to do things for their communities. There was community pride. So we built that culture. And I think if we can build this culture of resilience, it will take our step further in terms of not necessarily attaining the first climate resilient country or nation in the world, but importantly, of building that resilience. Because, as I said, we are going to be impacted. I mean, thank God we may not have any major impact so far in 2023, but you never know what may happen. It takes one system. And for us in Dominica, it doesn't necessarily have to be a hurricane, a trough with 6 inches, 7 inches of rain. And I mean, I'm telling you of the November 6th trough, that we had a fatality and we had some injuries. And certainly for us, because of our vulnerability to land slippage and our topography and all of those things, it's important that we create that culture of resilience in Dominica.
Yes, thank you so much for that. And I know we're getting ready to wrap up. I want to give you an opportunity to hear your final thoughts before we leave. I just wanted to read quickly an intervention by Doriel Gill. He says, thanks for your presentation. Just one small request. Since we need to have all communities involved, those in the deaf community would be disadvantaged since there is no one to communicate this very important information to them. Eagerly looking forward to the next presentation. I wanted to acknowledge this comment, this feedback, and just to rest assured for next time, it's something that we will take into consideration. We are really inclusive. We want everyone to be part of the conversation, so we will do that. And Michael says, for One Health approach to be effective, and the stakeholders be able to collaborate, information has to be made public and available across a broad range of thematic areas and stakeholders. So, are there steps being taken by regional governments to ensure that all this essential information that we are talking about is made accessible and, I guess, completely, wholly accessible to members of the public? You can just, you can log on somewhere, you can find that information. So, Natalia, would you like to take this one?
Yes, in America, there's there is the Pan American Health Organization, and they work with Ministry of Health and Ministry of Agriculture, and on many diseases, they have the website, the information, they have a lot of information about some disease. For example, in rabies, they have a platform, the Sirvera, that all people can see the cases of rabies in all America and the Caribbean country too. So perhaps we have to look in Google, but this is important. I said that the government have to take the information obligatory to the people, to show the people in Argentina. But I don't know if in other countries have. I think that no, not all countries don't have the information public. So this is important, and the people have to ask the information.
Okay. And we're wrapping up, but the questions keep coming. So I want to just ask one more, and I'll pose this one to Dr. Boodram. Someone wants to know in the audience, how does One Health, how does the One Health approach help us to prepare for the next pandemic?
So I think there were many, many lessons learned from the COVID-19 pandemic. And the very fact of the matter is that we need to pay more attention to zoonotic diseases and these potential animal to human crossover events. So what we basically learned, and especially from the health sector, is that we're working on many different aspects of strengthening our disease surveillance systems. So we need to be able to pick up an event quickly, very early, and deal with it there and then before it has a significant chance to spread. So within the health system, we're working especially in terms of disease surveillance strengthening across all sectors, as well as planning for potential responses. And I do have to say, one of the major interventions that is taking place right now is the administration of the pandemic fund through the World Bank entity. So within the last year or so, the World Bank called for proposals from different countries and regions across the world in order to seek proposals on strengthening pandemic preparedness. And I'm pleased to report that out of offering about $330 million, CARFA was one of the 12 entities awarded under this particular grant. So this is something that we're going to be working on, and we have many different strategies and interventions in place focused on early warning and surveillance system strengthening, and also, as I said, what to do should an event arise.
Okay, thank you so much for that. Now I'm going to give each of the panelists a challenge because we're running out of time, and I really just want to hear your closing thoughts. So, in 60 seconds each, a summary, probably what you would want our audience to take away, whatever it is that's on your mind, thoughts on One Health. And maybe we'll reverse and start with the gentleman among us and start with Mr. Tusa.
Okay. Certainly for me, it was a pleasure being part of this panel. And I want us to understand that we are going to be continually faced with the challenge of combating climate change. That is a reality. And so with that reality, it affords us the opportunity. And like every challenge, challenges provide opportunities. So it's an opportunity with the challenge of climate change for us to enhance our resilience mechanism throughout the region. That is very critical. And that's one of the things that when we have to think of it not, we have to think beyond the 9 dots. So we also have to think and align it to not necessarily fortunate for us. We have the hurricane season where we're off it. We get advisories and all of those things June to November. There are other things like the COVID-19 pandemic, and we are going to have those health crises that will come from time to time. How do we position ourselves as a region to mitigate the impact or to ensure that we are so aligned that the impact will not be as great as it can be. So I think I want to leave with that message that we do not have a choice but to position ourselves in being resilient from a wider spectrum. And I think that is the message that we have to leave here today. Thank you.
Thank you very much, and for accepting the challenge. Dr. Boodram, parting words.
Sure. So I'm in full agreement with Mr. Toussaint. But what I would like to say with respect to One Health, I mean, of course, our governments, our agencies, our ministries, they all have a very key role to play in terms of the national systems, policies, and infrastructure that we need to have in order to approach One Health and managing the different events that could potentially arise in the future, for example, the next pandemic. So there's a national, there's a regional, and there are international responsibilities as well. But I also wanted to stress, especially in the context of climate change, that there's also an individual responsibility and a community level responsibility. So while governments have the responsibility for building and sharing information, the individual and communities have the responsibility for seeking out the information, and as well determining how on a personal level they can actually deal with climate change and contribute towards advancing One Health.
Thank you so much for that. And we get the final words from our presenter.
Thank you. It is essential for One Health to involve the community, and especially young people. And I think we all think that the One Health approach is the only way to work with all these events, not only zoonotic disease, but all events. And it's the only way to prevent new pandemic. We have to work all together, and this is the only way to prevent new pandemic. And you know that the definition of One Health is dynamic, so we can change it. But the important is the only way to work with these events is in the One Health approach with all the people and the community.
Thank you so much for those parting words. And before we end, I'd just like to ask our audience if they have not done so as well, that feel free, please follow Internews on Facebook, Twitter, LinkedIn. The handle is Internews. There's also the Internews Health Journalism Network. And in so doing, you can keep up to date with Internews and the Health Journalism Network's events. And so we can also keep this important conversation going. I want to say thank you to Internews, to the Health Journalism Network, to the Clara Lionel Foundation, our presenter, Natalia Casas, and our panelists. They each brought such a unique viewpoint to the conversation. I really enjoyed this. Ashley told us about what young people are doing. Dr. Boodram let us know what CARFA is doing. And of course, Mr. Toussaint let us know what's going on in terms of the community and how we can strengthen communities. And it was a wonderful event. And thank you to our esteemed panelists. I'm Alison Kentish. Thank you to our audience. Thank you for your feedback, for your questions, and for some of the comments on how we could just strengthen going forward. And thank you for making this event possible. And goodbye.